welcome. You're watching Health and Wellness Myths and Facts. Most people have a basic idea about what hormones really are, but may not really have a full understanding of what their role and function is in the human body. Hormones play a role in almost everything that your body does, which means that even small changes in your hormones can have noticeable effects. Women's health is already a global priority and poised to emerge as an even greater and more urgent one for the post-pandemic world that we're living in. Women's health is the net result of the interplay between hormones, gender, sex, genetics, biology, and the socio-cultural environment. Hormones play a critical role in defining the biological basis of sex differences and a very pivotal role in a woman's health throughout her life. Now, when female hormonal imbalance becomes an issue, the consequences can manifest themselves throughout the body, taking a toll on a woman's health and the quality of her life. There are some conditions that can be prevented while others would require long-term treatment. Hormonal disorders can generally be managed well with proper medication and treatment. We have a panel of expert endocrinologists who will provide accurate and actionable advice to prevent the development of hormonal disorders and guide you, the viewer, towards effective long-term management strategies. Joining us is Dr. Harish Joshi, Consultant Endocrinology, Metabolism and Diabetology, Super Speciality Clinic and Hormone Diagnostics, Hubli. We also have Dr. Sridevi Patnala, Endocrinologist, CD Diabetes and Endocrine Center, Secunderabad, and Dr. Shivendra Verma, Vice Chairperson, Endocrinology, Diabetes and Metabolism, Chandan Hospital, Lucknow. Thank you very much, doctors, for being with us. Dr. Joshi, to you first. It's been observed that cases of hormonal disturbances are increasing in women of all ages. Is it because of changing lifestyle, and what, according to you, are some of the common causes for these hormonal disorders that are rising in women?
Regarding the lifestyle factors, in today's world, we all of us are more in the academic excellence mode. So we don't bother much about the diet, and we don't have enough time to take care of a diet. The parents both are working, so children also are more in the habit of eating ready to carry and ready to eat foodstuffs, and that contributes to the weight gain that we all are seeing nowadays. And the lack of physical activities is a associated problem. All of these contribute to the teenagers getting more weight at a very young age, and that eventually disrupts what you call the hypothalamic pituitary gonadal cycles. So gonads refers to the ovary in a woman, right? And the ovarian cycling, which starts at the time of puberty around 13 or 14 years of age, is very much sensitive to the fat muscle ratio. So if there is lack of activity, and more of these junk foods that we have, then we end up with what you call lack of proper stimulation of the ovulation in the ovary, and that creates this what we call delayed ovulation and its attendant side effects. Along with this, we also have something called endocrine disruptors, which we all are aware of, but we are unfortunately unable to address it adequately. In the Western field, the endocrine disruptors have been worked upon. India also. What does this mean? The chemicals that we have in our food chain, in the water sources, they contribute to it. It could be, let's say, the plastic containers which contain bisphenol A that can interfere with the endocrine enzymes and the receptors level. It can contribute to obesity, and PCOS, PCOD also contribute to thyroid disorders. The deep borewell water that we use, the heavy metal content that it has, and the wrong type of filters many times that we have in our water filtration mechanisms. All these are factors which contribute to the current problems that we see nowadays in our population.
Right. Dr. Sridevi, if I can ask you, women are more likely to develop hormonal imbalance disorders as compared to men. Which are some of these disorders that are more common in women, and why is it so?
Come from younger age to older age. The most common disorder seen in adolescent girls is PCOS, which is an hormonal imbalance which results in irregular menstrual cycles and other cosmetic problems like unwanted hair and all. And this is mostly due to genetic factors and girls gaining more weight because of lack of proper physical activity and eating junk food and stress, as well as jobs like night shifts, etc. Other very common disorders which are seen in women are thyroid disorders are more prevalent in women because most of the thyroid disorders are autoimmune nature, and autoimmunity disorders are more in females because of the genetic background of 2X chromosomes, and the female hormone called estrogen affects the immunity in women, which leads to more autoimmune disorders. Another very important endocrine problem or say metabolic problem is obesity. Women in general are more obese than men. That is because of the social factors like decreased mobility when compared to men, sedentary lifestyle, and also the food preferences in women are slightly different from that of men, and also some factors like menopause which causes rapid weight gain in women. And other very important hormonal problem or you would say metabolic or bone related problem which we see in women when compared to men is osteoporosis. That is bones becoming very weak and brittle and leading to fractures. This again is because of low calcium intake in most of the Indian women and also not taking care of proper bone health during pregnancy and lactation, and also the menopause which alters the female hormones leading to weakness of the bones. So these PCOS, obesity, thyroid disorders and osteoporosis are four important diseases which are more prevalent in women when compared to men.
Right. Dr. Sridevi, if I can just, ask you a quick follow-up question to that as well. What are the common signs and symptoms of PCOS? You just, talked about PCOS as well, and that's, one of the things that causes a lot of problems. Is it possible that you have PCOS, but you don't have any symptoms? What more should people know about this?
Yeah. So basically, PCOS means it's actually a triad. I mean, three common things are seen. One is irregular menstrual cycles. The girls usually or women usually have infrequent cycles. Instead of having a monthly menstrual cycle, they have cycles only once in 2-3 months, and whenever they have cycle they may have excess bleeding. That is one common symptom. Second important symptoms is presence of unwanted hair, mostly in the face, upper lip, chin, etc., and also increased acne, that is pimples. These are two common symptoms, and some women directly present with infertility. I mean, not able to conceive children, not able to bear children, and PCOD is the most common cause of infertility worldwide. So and also some other problems like discoloration of the neck and gaining weight, all these also are a part and parcel of PCOD. And yes, if an ultrasound, so PCOD actually is a triad. So irregular menses, presence of unwanted hair or pimples or increased testosterone level in your blood, and ultrasound, I mean scanning picture of PCOD. It's possible that you have on a scan, if done for other reasons like abdominal pain, they might show PCOD, I mean polycystic pattern, lot of cysts in your ovaries. But it is not necessary that every woman who has polycystic disease polycystic pattern in the ovary has PCOS. It is called disease only if it is associated with irregular menstrual cycles, and it has another features like hyperandrogenism, pimples, unwanted hair, etc. Because 10% to 20% of even adolescent girls can have this polycystic pattern on ultrasound, and it is not pathological. So only if it is associated with irregular menstrual cycles and other signs, then only we say it is as a disease.
All right, that's a very comprehensive understanding of the symptoms. Thanks, Doctor, for that. Dr. Verma, if I can bring you into the conversation, welcome. How does hormonal imbalance, play out in women? How does it impact their health in general?
Yeah, good afternoon, everyone. And that's a very good question, that how does hormonal imbalance affect women's health? So in fact, every disorder which is associated with hormonal imbalance, like hypothyroidism, hyperthyroidism, diabetes per se, all are metabolic disorders, affect health of both men and women, and particularly women also. As ma'am has pointed out earlier, that even at menopause, there is hormonal imbalance that may lead to osteoporosis. There can be excessive hot flushes, etc. Even during normal menses, we do see a lot of females complain of worsening of their migraine headaches, general headaches as well. There may be mood disturbances. So even during when the hormonal disturbances or hormonal fluctuations are there, whenever are there, even during normal physiological states, they can affect women's health. When coming about the PCOD per se, there can be five important things which can affect women's health. Some of them have already been pointed out by the ma'am herself. Most common is an ovulation that is prolonged, amenorrhea or absence of menses. That is very disturbing for many females, and in fact, it is the most common symptom with PCOS. Second thing is abnormal unwanted hair over the body that we call as hirsutism. That can be very disturbing and require prolonged treatments, multiple treatments, including lasers as well. There can be acne, or there can be, in some women, when there is severe PCOS, women can have baldness or androgenic alopecia as well. The other important thing is infertility in couples. As already been pointed out, this is the most common cause of infertility. So these are the directly related adverse consequences of PCOS. When coming about the metabolic consequences or other consequences, the greatest risk is health-related risk is carcinoma endometrium, that is uterine cancer, when there is prolonged amenorrhea or prolonged absence of menses, because again, you have high estrogen levels continuously, your endometrium is exposed of, there is hyperplasia, and such women are at risk of carcinoma in situ, and later on they can have carcinoma endometrium. That's why you have been asked for doing multiple, you can say, routine tests whenever we plan for the treatment if you have prolonged amenorrhea, just to rule out this carcinoma endometrium. The other important health-related issue that may be associated with PCOS is diabetes, because insulin resistance is at the heart of this cause of this PCOS. And since it is also associated with poor lifestyle and obesity, there are other adverse cardiovascular events that these women who have obesity and PCOS, there are high chances to have future risk of heart attacks, strokes as well. So these are the major adverse health-related issues that may be associated with PCOS.
Right, Dr. Verma, if I could ask you a quick follow-up question as well. What is the main difference between PCOS and PCOD? People often confuse the two. They can also be used interchangeably. So what's really the difference?
Yeah, actually, these two disorders are used very frequently, and you can say these are not different from each other. However, in some of the texts, it has been written that PCOS is one of the severe forms of PCOD, while PCOD is polycystic ovarian disease and PCOS is polycystic ovarian syndrome. Now, better we should call this polycystic ovarian syndrome. Why? Because we call syndromes with those disorders in which we are not sure of exact pathophysiology or exact etiology. Till date in medical science, PCOD, though it is very common, seen in 8 to 15% of women, but still we are not exactly we can pinpoint what is the exact cause of this disorder. There are multiple theories, hypotheses, like right from the insulin resistance, poor lifestyle, increasing weight gain. There is a strong family history of also PCOD, and some of the recent studies have shown association with some genetic mutations like luteinizing hormone, follicle-stimulating hormone, insulin gene itself, right from the pituitary to the level of the ovaries. Multiple theories are there. But again, since we are not sure what is the exact cause of this disorder, we still are living with multiple theories. We should better call it as PCOS rather than PCOD.
All right, so that's an important clarification there coming in as well. We're going to slip into a very short break, but our conversation with the doctors will continue on the other side. Stay with us. Welcome back. You're watching Health and Wellness Myths and Facts. Dr. Joshi, if I can come to you, PCOS affects many women worldwide, and it is one of the leading causes for infertility as well. What does PCOS essentially mean?
See, basically what happens is when we use the word PCO, it means polycystic ovarian syndrome or polycystic ovarian disease, right? Now, poly means multiple, cyst is an unruptured egg. So normally the ovulations which occur mid-cycle in a normal cycling lady, if that doesn't happen, it remains behind as a cyst. So it's not a very ominous condition. PCOS, people assume it's very ominous. It's not like that. The monthly cycling which should occur has not occurred. The eggs have remained behind. So you have 6 or 8 eggs accumulated over a period of 6 to 8 months. That becomes polycystic ovarian disease. So now this failure of ovulation should be the appropriate word that we use. Academically, we call it as failure of ovulation. That can have multiple causes. When other causes are ruled out, other endocrine causes are ruled out, let's say we rule out a pituitary disease, a thyroid disease, an adrenal disease, then we say, okay, what remains behind is polycystic ovarian syndrome, right? So we need to rule out these things and then we say it's PCOS. It's nothing but a failure of ovulation. Figuring out why there is no ovulation is what we are planning to do as a specialist.
Dr. Joshi, if you've been diagnosed with polycystic ovary syndrome, PCOS, it's been explained, it is important to understand the long-term sort of health risks that are associated with the disease. What are the health risks long-term for women with PCOS?
Right. See, around 80% of the women with failure of ovulation or PCOS have what you call insulin resistance element to them, particularly in Southeast Asian countries and particularly so true in India. And this is associated invariably with a higher fat to muscle ratio of the person. May not be really true obesity, but they may have abdominal fat mass which is more, what you call visceral fat excess. And this is associated with what you call non-alcoholic fatty liver disease, commonly called as fatty liver. And over a period of time, when the compensatory insulin excess fails to keep the sugars normal, that time we diagnose as diabetes when the insulin levels have dropped below the compensatory values and the sugar starts rising. So diabetes is, after many years of PCO untreated, they can end up with diabetes. During this interim period, which could last a decade or two, there is an increase in the chances of, what you call atherosclerotic progression. So it could what you call macrovascular disease. So many people with, let's say, diabetes or cardiac problems or strokes, women, 20 years before you ask them, many a times they would have this history of irregular cycles, being more in weight than usual. They also have this problem with conceiving. Infertility is a consequence. Multiple ovulation cycles they have to undertake in artificial reproductive centers. So all these are problems. Other problems which can be there is, let's say, gallbladder stones, what we call cholelithiasis. That's one thing. They also are more prone to have hypertension and the dyslipidemia, abnormally high LDL, low HDL, and high triglyceride. This all ultimately is called as a metabolic syndrome or a pre-diabetic syndrome. And these are people who can have higher chances of breast neoplasia, endometrial neoplasia, and rarely they can also have converted into cancers. It's not that they're too scared, but when treated on time, nobody should develop cancer of the breast or in the uterus, the endometrial CS. So all these can be avoided by tackling this issue in young age itself.
Right. Dr. Sridevi, what are the treatment options that are available for women with PCOS?
So, as I said, PCOS is the most common cause of irregular cycles, and treatment depends upon what the lady present with. So, actually, most of the PCOS girls or women are obese or overweight, and weight loss is shown to improve outcomes through proper lifestyle, dietary medication, regular exercise of at least brisk, something like brisk walking 30 minutes a day for 5 days a week, and all is known to improve the menstrual cycles and also improve the chances of pregnancy. So lifestyle modification is to be there at every stage of treatment of PCOD, especially if the girls and women are obese or overweight. And also having proper sleep. Nowadays, we have seen increased number of PCOD patients in doing night shifts and all. So because this any night shift alters the hormonal rhythm in the body and they are no more prone to disease. So having a proper sleep pattern also is very important. Second, then again, the treatment depends upon what the girl or the woman wants. Some girls or women are worried about their menstrual cycles. So if they are worried about their menstrual cycles, the treatment options are either hormonal pills, something called containing estrogen and progesterone, which help to given monthly to regularize their menstrual cycles, or if the women do not want to take monthly monthly hormonal pills, then we can give something called a progesterone medicine once in 45 days or 2 months for them to have a menses. So if it is for the menstrual cycles, hormonal treatment is the choice, either a hormonal pill or what we say OC pills, to have regular menstrual bleed, or progesterone to have menstrual bleed whenever required. So, but if the girl or woman is more concerned about unwanted body hair, what we say hirsutism, like increased pimples or unwanted body hair, which most of the adolescents, girls, college girls are more worried about their hair rather than their menses. So here the treatment options vary. Again, the best choice is again giving a hormonal pills, which will bring down the androgen, the testosterone levels in the girl, and the facial hair and all will come down over a period of time. But if the women are not willing to taking these hormonal pills, then what we have some medicines called anti-androgens, the most common of which is called spironolactone, which should be taken for at least a period of hirsutism. The treatment is difficult. They need to take regular medication for at least 1 year for the effect to come. And if the patient doesn't want to take any medication for unwanted hair, then they can go for non-medical therapies like laser treatment. So focus like laser on areas of unwanted hair will help to decrease the hirsutism. So if it is because of unwanted hair, then either medicines or laser therapy can help them. But if it is for fertility, I mean, some women are not bothered about their menses. If they are married, they want to have children, then the best choice is to go for a ovulation induction therapy, which mostly we refer to gynecologists, where they give medications like clomiphene and letrozole and still IVF treatment or anything if these are not working. So it all depends upon what the lady or girl presents with. So for menstrual irregularity, treatment is different, hirsutism treatment is different, and for fertility, the treatment is different.
Right. Dr. Verma, what are the lifestyle modification steps that are advised for women with PCOS?
If you lose 5 to 7% of your body weight, if you are on overweight or obese side, you can actually have resolution of many of the problems of PCOS, like irregular menses, as well as decrease in the unwanted body hair. So definitely those who are overweight and obese, it is advisable to target at least 5 to 7% and sometimes up to 10% of the weight loss. Now the important question is how to achieve it. So most important thing is to have a calorie restriction. We don't actually calculate our calories, and there are some hidden calories in terms of oily foods, because Indians do have a lot of oily foods and we are not able to calculate how much calories we are dealing with. For example, if you eat one samosa, this is around 250 to 300 calories, which is almost half of your daily meal requirement, one meal requirement. So just avoiding these foods, just to say avoid the junk foods, French fries, pizzas, burgers, especially our adolescents, which may have PCOS problems. So just ask them to avoid these foods and instead ask them to take more of a complex carbohydrates, more of sprouts, more of green vegetables. Ask them we have to prescribe more of fruits and vegetables, and it is recommended to have 2 to 4 daily servings of fresh fruits and green vegetables. Other things you can advise for not using oil, too much of oil during cooking. You can use oil sprays to saute of the instead of deep cooking or prolonged frying. You can use saute your vegetables. This is about the dietary modifications. And second thing comes is the daily physical activity. For the adolescent girls who are in their teens, there should be more vigorous activity should be prescribed, in at least 1 hour of activity. And there should also be, apart from just jogging, running, and isotonic activities, there must be some strengthening activities also for bone strength as well as muscle strength for the young girls. For the women, again, 30 to 45 minutes of daily physical activity of at least brisk walking, jogging, running is advisable. This will not only help in dealing with PCOS, but will also help in building up endurance,
right,
in just about reducing body weight and also preventing diabetes also. So this is about the lifestyle modifications.
Okay. I think that's very useful advice. Thank you, doctors, very much for joining us on the show.
Yeah. Thank you.